Pneumonia by
Pneumonia by Doris Ruiz.
Pneumonia.
What is pneumonia? Pneumonia is a common lung infection caused by bacteria, a virus, or fungi. Pneumonia is an infection of one or both your lungs. Pneumonia is not a single disease. It can have more than 30 different causes. How is it spread? It is often spread via coughing, sneezing, touching, or even breathing, and those who don't exhibit symptoms can also spread the illness. Approximately 1/3 of the pneumonia cases in the United States each year are caused by viruses. Pneumonia in children. Kids with pneumonia caused by bacteria usually become sick fairly quickly. Often pneumonia begins after an upper respiratory tract infection, an infection of the nose and throat, with symptoms starting after 2 or 3 days of a cold or sore throat. Symptoms in children: fever, shaking, chills, cough, stuffy nose, very fast breathing. In some cases, this is only symptom. Breathing with grunting or wheezing sounds. Working hard to breathe. This can include flaring of the nostrils, belly breathing, or movement of the muscles between the ribs. Vomiting, chest pain, abdominal pain, which often happens because the child is coughing and working hard to breathe. Less activity. Loss of appetite in older kids, or poor feeding in infants, which may lead to dehydration and exhaustion. In extreme cases, bluish or gray color of the lips and fingernails. Diagnosis in children: chest x-ray, blood tests, bacterial cultures of mucus produced by coughing. Treatment of pneumonia in children: antibiotics. The type of antibiotic used depends on the type of pneumonia. In some cases, other members of the household might be treated with the medication to prevent illness. Pneumonia in the elderly. In the elderly, pneumonia often develops when having the flu. Pneumonia is a fourth leading cause of death among elderly. Typically, pneumonia occurs when a patient's immune system is weakened due to another illness such as bronchitis or the flu, and many people develop it in the hospital. Symptoms in the elderly: coughing that may produce phlegm, mucus, fever, sweating, and chills, shortness of breath, chest pain. Older people may have a lower than normal body temperature. Diagnosis of pneumonia: a blood test, a sputum test, pulse oximetry, a urine test, a CAT scan, a fluid sample, and bronchoscopy. Treatment of pneumonia in the elderly: antibiotic, antiviral, antifungal. Drugs are used to treat pneumonia depending on the specific causes of the condition. Most cases, the bacterial pneumonia can be treated at home with oral antibiotics, and most of the people responded of antibiotics with 3 days. Prevention against pneumonia. The first line of defense of pneumonia is to get vaccinated. There are 2 types of pneumonia vaccines are available in the United States. One is Prevnar 13. The vaccine is effective against 13 types of pneumococcal bacteria. The Center for Disease Control and Prevention, the CDC, recommends this vaccine for babies and children under the age of 2. Adults ages 65 or older, people between ages 2 and 65 years with chronic conditions that increase the risk of pneumonia. Another, Pneumovax 23, is a vaccine effective against 23 types of pneumococcal bacteria. The CDC recommends it for adults ages 65 or older, adults 19 and 64 who smoke, people between ages 2 and 65 years with chronic conditions that increase the risk of pneumonia.
Created using Powtoon.